Faith, thank you very much for joining us on the last episode on our podcast series of the International Women's Month. So, climate change may affect our health and well being through the impacts of extreme events, worsening air quality, changes in the spread of infectious diseases, threats to food and water quality and quantity, and effects on our mental health. What are some of the physical and mental health effects of climate change that you know of? And what response strategies are in place to mitigate the damage?
I think maybe just to start us off is to acknowledge the fact that sub-Saharan Africa is expected from the different research that has been done, it's expected to suffer the most when it comes to the climate crisis, but also that there is obviously increased risks when it comes to human health. And in fact, when you look at some of the reports that have been published by the World Health Organization, there is confirmation that areas that have weak infrastructure, mostly within the developing countries, but also more specifically in Africa, will definitely and have actually been the ones that have suffered the most. And estimates are that between 2030 and 2050, that the climate change is expected to cause about 250,000 additional deaths every year. And that's due to malnutrition, because of the reducing levels of food production and general food availability, but also because of different diseases like malaria and diarrhea, but also because of heat stress, because in certain areas due to the drought, there's been high levels of heat stress, and we've seen how, for instance, pregnant mothers have suffered from this particular heat exhaustion. And when you look at, for instance, some of the statistics around costs, it's very shocking how the climate crisis is also contributing to this, and there are direct costs because, for instance, when it comes to healthcare that needs to be provided to people who have been affected by the crisis generally, whether it's due to floods or it's due to droughts, maybe it could be dehydration because of limited access to water, and so on and so forth. These are some of the challenges, and it's estimated that in terms of costs, developing countries will generally lose between 2 to 4 billion US dollars by per year by 2030. But we also know that there are extended there are other costs associated with, for instance, food production losses, but we also know that there is also challenges when it comes to water and sanitation. And more specifically, because usually when we talk about the link between climate change and health, one of those areas that is rarely discussed, and perhaps because the link between climate change and gender has not extensively been discussed. Find there is growing discussion around it, but I think acknowledging that there is a clear link between climate change and sexual reproductive health and rights is something that we must acknowledge. One of the things that is clear is, for instance, how it has affected maternal health. We know how, for instance, pregnant mothers, but also lactating women, also particularly suffer in one way or another when it comes to changes in food availability. We see how women, particularly at who live at the who live around fishery communities have also been affected when it comes to, for instance, socioeconomic their socioeconomic rights. Because of reduced incomes, we've seen a rising number in the number of women who are involved in sex work. And the challenge is the fact that because of the impact that climate change has on individual incomes, but also on national level incomes, we've seen reduction in access to sexual and reproductive health services like condoms. So family planning then becomes a challenge. So we've seen rise in the number of women giving birth to experiencing unintended pregnancies, but also women increasingly being exposed to HIV/AIDS. And so recognizing that particular link is something that is very, very critical. And definitely, yes, there have been efforts that have been made at various levels. And in terms of, for instance, trying to deal with the food insecurity, the undernourishment that comes with the climate crisis, we've seen that there are efforts and that there's proliferating number of private sector and companies that are investing in provision of seed of different improved seed varieties with the intention of basically increasing production and productivity. But again, we've seen that in doing this, there are certain traditional seeds that have been ignored, but also increasing the burden on women, because then with improved varieties controlled by private sector means that rural women must incur more income in buying these seeds every other month, which then reduces the amount of money that's available for them to access medicine, and given the high out-of-pocket expense that comes with healthcare, but also recognizing the role that women play when it comes to care work, then increases the burden of women, and then they have to choose between accessing healthcare and providing for their families in terms of food. But also, besides dealing with the challenges that have affected the agriculture sector and food provision, we've seen that there's also been efforts to reduce emissions, greenhouse gas emissions, but also we've seen that there has been efforts to try and reduce the level of greenhouse gases within the atmosphere. And while some of these efforts are relevant, there's also been questions about their effectiveness. We've seen also that there's increasing promotion of, for instance, adoption of use of chemical fertilizers, again, to increase production and productivity within the agriculture sector. But all these, when you look at all these solutions, they have largely been deemed as false solutions because they fail to strike the balance between economic rights as well as addressing the climate crisis. Also, in addition to the efforts that have been made, that there has been efforts to address the climate crisis in terms of mitigation. But again, we've seen that when it comes to most of the mitigation efforts that have been adopted, that it's key contributors to the climate crisis that are actually benefiting in one way or another. But we recognize that these efforts may have individuals when it comes to, for instance, access to healthcare, because then attention, we've seen that attention has been drawn towards mitigation as opposed to adaptation, and yet healthcare, access to healthcare really falls under the aspect of adaptation when it comes to climate change. Also, we've seen a discussion around how to reduce the population, because there are claims that there's a link between population growth and climate change. And indeed, there is quantifiable linkages. But population growth is not a main contributor to climate change. Even when you look at the data, we've seen that the richest half of the countries that emit 86% of global carbon dioxide actually have the lowest fertility rates. So it's really an indication that targeting population growth is within the aspects of health is really not would actually not be should not be the main focus. In terms of what needs to be done, obviously, when it comes to addressing and ensuring that climate action helps to not only contribute towards achievement of gender equality, but also towards addressing poverty and contributing towards rural development. I think one of the things that needs to happen is prioritization of implementation of locally led climate solutions, because centering these indigenous individuals, centering rural communities, then helps to balance, to strike a balance between addressing their health needs, addressing their economic needs, but also addressing the climate crisis. Also, investing in sexual and reproductive health is a provision of sexual and reproductive health services is also imperative, because then it will contribute towards building more resilient populations, but also this then must be done by ensuring that the health systems are strengthened to be more resilient, to support in terms of climate change disasters, but also to reduce the impact of climate change on people. And we know that the realization of sexual and reproductive health and rights by increasing access for women and girls helps to build their resilience, but also helps to enhance their adaptiveness to climate change. And it also then helps them to be able to commit more time towards contributing to building local solutions and alternatives that can be used to address the climate crisis, whether it's in terms of health technologies. We've seen how certain women have been able to contribute towards building technology that can be able to support, for instance, pregnant mothers, but also deal with, for instance, challenges around dealing with malaria. And I think all these are some of the things that need to be put into consideration when it comes to the linkages between climate change and health.